Hello, welcome to the panel on data and digital services. I'm Bleddyn Rees, the chair of the Digital Health Society, and it's my privilege to introduce the last speaker to our panel today, Dr. Amit Thakker from Africa. Amit is a visionary entrepreneur and pioneering integrating the private sector into the health system in Africa. He is president of the African Healthcare Federation and chair at the African Health Business. So the first question, Amit, what are the key challenges for your health system faces to recover from the pandemic?
Thank you, Bleddyn Rees. It's been really revealing to us in the pandemic. The two main, or several challenges have been revealed, but the ones that are really large challenges are the supply chain challenge. It's very clear that the road to self-sufficiency in Africa needs to be strengthened. We need to strengthen the entire supply chain of medical commodities, pharmaceuticals, vaccines. We've been relying a lot on the outside Africa to provide Africa with all the supplies. So over 95% of the commodities and pharmaceuticals are coming from outside Africa, and over 99% of the vaccines are coming from outside Africa. So the pandemic actually showed us that when the supply chains are disrupted and stopped, we are suffering internally in Africa. So that's the biggest challenge. The second one was on services, health services, and strengthening our human resources for health. And the health worker shortages are critical for us to address. So without a health workforce, there is no health. And that's where we're looking at utilizing the youthful population in Africa to increase the health workforce that we see for the future. So those are the key two challenges that we are facing.
Great, thank you. Second question, what digital tools and innovations is your health system using to support the recovery from the pandemic?
We've begun using the tools of collecting demographic data. The tools that are commonly used now in all the ministries of health is who has received which kind of vaccine and when. They quickly needed to collect data around the supplies as well as deployment and monitoring. It looks like the health system has become stronger in the whole end-to-end data management systems. So I think that's one tool we've used. The second tool we've started using much more in our health system, which is great, is reporting side effects. Most countries are now able to empower the patients and communities to talk about the side effects. Now, I use these examples as digital tools that are empowering the health system and innovations because it's bringing the community and the patients closer to look after their own health. It's what the pandemic has taught us. The other tool we are using is connectivity. We're connecting the health service providers to the patients through the model of telehealth and telemedicine to enable us reach the population that had to come to primary healthcare centers. And due to the pandemic, we realized there was reluctance and a little bit of a scare to visit health facilities because they simply didn't want to contract the virus while visiting health facilities. So the second tool that I think we are now slowly adopting is the tool of telemedicine. Those are some of the tools that we are using in innovation. Of course, there's also the telepathology, the teleradiology. So all the facets around telehealth are tools that we're using.
Great, thank you. And then the third question, how do you see data playing an important role to support the recovery of your healthcare system in Africa?
Yeah, that's a really good question. And I think data is so critical. It gives you an insight to the entire planning of the health system. So data is going to reduce all the inefficiencies and waste. If you know exactly what's happening in your country, in your region, and you are very clear about the outbreaks, the epidemics, the disease trends, I think it gives you better planning and use of resources. So data is going to then provide us the information. The information then is going to be collated to give us knowledge. So data becomes information and information becomes knowledge. And knowledge is going to be then extremely powerful for you and the health system coordinators to make the system work more efficiently, use the resources more appropriately. So it's been brilliant how data is playing a role in improving healthcare. We know the right amount of health at the right place, at the right cost, at the right time. So we can get better health for the same money with data.
Great, thank you. That's a great way to end. Right place, right time, right service. That concludes this panel, and thank you for your attention, and enjoy the rest of the Global Health Connector and ViVE events. Thank you.
Thank you then.